So today thank you for recording. So today I will be talking about how Sheboygan County Health and Human Services is working towards making all our department policies and documents to be equitable and inclusive. I'm going to focus mostly on our policy assessment tool since that has already been implemented. At the end, I will also touch on a vital document assessment tool that we hope to launch in the future. Um, so just for a little bit of context before I get started, our Division of Public Health is a part of our Health and Human Services Department. And part of my position is working with the other Health and Human Services divisions, which include behavioral health, child and family services, economic support, and child support. Next slide. So just a little bit about Sheboygan County Public Health. We are, for those who don't know, we're set along the coast of Lake Michigan, halfway between Milwaukee and Green Bay. We have a population of just under 118,000, with our largest city being the city of Sheboygan, and we also have a lot of rural areas as well. Our largest minority populations in the county, we have a Hispanic Latinx community of 7.2% of our population, and 6.6% of our county is Hmong. So our public health programs include our clinical services program. We have a community engagement, which includes maternal child health, Healthy Sheboygan County, which is our prevention coalition that our CHIP works through, that we are the backbone organization for. We have a healthy aging group, and we also have two bilingual community health workers. And then we also have a environmental health program. WIC is in our public health, and also we have a neighborhood social worker program that is just over a year old. So that's pretty new, and that is called Families and Neighbors Together. So we have two neighborhoods in the city of Sheboygan that have social workers that work within those neighborhoods. Next slide. Thanks. Okay, so the foundational capabilities addressed with this work that I'm going to be going over. So the work that we're doing with our policy assessment tool, we also are doing a culturally and linguistically appropriate service standards implementation or CLAS standards implementation combined with our civil rights compliance, and eventually creating that vital document assessment tool. They all fall under the foundational capabilities of equity, policy development and support, and accountability and performance management. For these projects, I'm working closely with our health officer, our health and human services division managers, and our department's trauma-informed care and equitable practices strategist, who she is also a part of our public health team. And we're also working with our community engagement supervisor and who supervises our maternal child health team as their grant objectives are focused on health equity as well. Next slide. Okay, so going into our policy assessment tool, this is a mission, vision, and values policy assessment tool. And the goal is to ensure that all Sheboygan County Health and Human Services policies are inclusive, trauma-informed, and aligned with the mission, vision, and value statements of the department. The tool was created in 2023. It was rolled out in 2024. And then revised in November of 2024 for re-implementation this January. It was originally implemented by our trauma-informed care and equitable practices strategist and our Health and Human Services Policy Committee chair, with buy-in also from our HHS director. I was brought in 2024 to help with assessing the process and working together to implement improvements. Next slide. So when research was being done to determine best practice for this assessment tool, we found that it aligned with our already existing mission, vision, and values. So a little history on that. We spent a lot of time determining our department's updated mission, vision, values in 2018, which included input from everyone on our Health and Human Services staff using a World Cafe model and using SAMHSA trauma-informed care principles as our guide. So instead of making up from scratch what would be included in a policy assessment tool, we started to see that they were all aligning with what we already had and what we already got the input from all of our staff for our mission, vision, values. So we decided to use those in our tool. And on the next slide, it goes into what those mission, vision, and values are. So our mission is partnering with the residents of Sheboygan County to improve health and quality of life through education, building community connections, and empowering all to be their best selves. Our vision is that all Sheboygan County residents are valued, resilient, and thriving. And then finally, our values are safety, collaboration, person and family centered, compassion, trustworthiness, accessibility, results oriented, resilience, and integrity. So all of those values also have corresponding value statements to go along with them. When the values were being implemented back in 2018, our HHS director wanted to know, like, what does that mean? I don't want somebody to see like one of our values is safety, and then they have a question of, what do you mean by that? So we have a lot of statements that go along with it that describe what we mean by that value. So they're not necessarily up for interpretation by each individual person. Next slide. So next for our program implementation, all of our policies are housed within a software called Policy Stat, which ensures that all of our policies are reviewed on an annual basis. So we have probably close to 100 policies and growing in our department as a whole. So again, that's not just public health, that's our entire HHS department. But our assessment tool is now a part of that process to be reviewed annually. We work with our department's policy committee to ensure that the tool is being completed annually. If it's not completed, it's sent back to the owner of that policy to complete the tool. The onboarding of this tool was introduced at a department administrative meeting that includes all department managers and supervisors. In that policy stat software, for each policy, there is an identified policy owner, which is generally always a manager or a supervisor. So we were able to onboard people to that in one of those administrative meetings. Next slide. So here is a screen grab of just a little piece of what this tool looked like when it was first implemented. Our county uses Google Suite, so all of this is housed within Google Sheets. The tool consisted of one spreadsheet for each department policy, which again, as I said before, that's like almost 100 at this point, maybe 80 something. And that included 30, I believe it's 36 checkboxes where the policy owner needed to determine if their policy was either consistent or inconsistent with each statement, or if they were unsure and like needed some guidance, or there was that blue box is not applicable. So again, but the green box would be, yes, this is an alignment. The red is that it is not, or it's inconsistent. The yellow is that I'm unsure, and the blue is not applicable. So if any statement was answered as inconsistent or unsure, the policy owner is then referred to myself and our TIC and equity practices strategist for a consult to determine if the policy can be updated to become in alignment. A consult is also provided if a policy is determined to have a certain percentage of not applicable answers. So we know sometimes policies are just like rules that come down that we don't have any control over. So maybe if they're not applicable, that doesn't mean that we're necessarily going to change the policy to make them applicable, but we at least want to have that consult with the person to talk that through. Each sheet also included an instruction tab that told the policy owner how to create their initial sheet for their policy and how to link it directly to their assessment sheet at the bottom of their policy within the policy stat software. Each Google Sheet had a tab for each year from 2024 all the way to 2033. This meant that once the sheet was created, the policy owner could return to the same sheet every year and fill out the assessment on the current year's tab. Okay, next slide. So challenges and solutions. We did come to some challenges. So in the fall of 2024, we sent out a survey that just went out to anybody who owns any policies in that policy stat software to gauge how that how the tool implementation was going. So some of the barriers identified from that survey include that the assessment was so long, it overwhelmed the people who needed to complete it. And also there tended to be certain people within the department who have like a long list of policies that they own. So it just got to be like too big of a task to get done. So one change that we made after almost a year of using the tool was to reduce the number of boxes to check on the assessment tool. So one of the reasons I really mentioned earlier that we have all of these like statements that go along with our values to explain what we mean by that is on the original tool, each of those statements had its own checkbox that you had to assess your policy for. So we decided to condense that so that when we got to the values, um, the value statement, all the value statements are in one box. And so somebody has to mark if their policy aligns with that statement as a whole, and they can take into account all of those examples that we have. The next challenge was that the overall process of completing the assessment tool was time consuming. So as I said, for the first bullet, it was just long, but it also that meant it was really time consuming to complete. So the people who are filling this out, again, are leaders. They are very, very busy. It tended to just become a burden to a lot of them and also just at the bottom of their priority list. So another biggest change that we made was to make one spreadsheet that includes all policies divided by work area instead of one spreadsheet for each policy. And I'll show an example of that in a moment. And then another challenge that we continue to face is staff investment in this process to ensure that they know why we are taking the time to do this work. This challenge is a little more difficult to solve with potential solutions. So that's something that we're still working on, including continuing to educate our staff about the importance of trauma-informed care and equity and inclusion, while realizing that there's still a lot of room for improvement to shift our culture. And on the next slide, I can go into a little more detail about the changes that were made. So after the survey of all the policy owners, I worked with our policy committee chair and TIC and equitable practices strategist to improve the tool and make it more user-friendly. So as I mentioned before, we cut down the number of checkboxes, which are actually now drop downs. From I think it was 36 to now we have 11. So that, like I said, the extra content is still there, but the description of each value statement is in that box. So an example here is that one in the middle that says safety. It has in bold, like we believe in promoting physical and psychological safety for all our staff and service recipients. And then all that other text under there is the examples of what we mean by that. And then the policy owner can go to the drop down and say if it's consistent or inconsistent, or if they have a question or anything like that. And then again, instead of one spreadsheet for each policy, there is one spreadsheet for each calendar year that lists all the policies. So this is just kind of a snippet of what this looks like, but the whole Google workbook spreadsheet has one tab for each division and work area. So this is a screenshot of our public health tab. So we have already in January assessed our rabies control policy, as you can see on there. And then if you scroll, when you're in the tool, if you scroll to the right, there continues to be all of our policies listed. And then when you scroll down, it goes down to all of the questions that need to be answered. And it also has a place to write notes and fill in who, the person who completed the tool and when they completed it. So we're hoping that this makes the process more user-friendly for our policy owners. We will be checking in with them to see how that's going. But again, this has only been about a month that this has been launched. This also has reduced the burden for future quality improvement changes to the tool. So originally we were going to keep having the like one sheet for every policy. But then we got to thinking like, okay, if we want to make a change, like even the slightest change to this tool, we have to make it on like almost 100 spreadsheets, which is just like not worth the time. So we have it all in one sheet. So now if we get feedback that we can make this tool even better going forward, we just have to make it that change to this one sheet and it'll be really simple to implement. One positive about the old process was that all the policies were going to link directly to that specific policy's historical completed assessments. So now that everything is in one spreadsheet, all policies have a link at the bottom that takes them to the folder where all of these annual review spreadsheets are saved. So if you're in the policy, you can click that link, and then you'll get to that Google folder, and you just need to select the year that you're in to complete the assessment. And then in that folder, there'll also be like, so say we're in 2028, I could go back to 2025 and see what I answered for that as well. But we did want to avoid the need to update a link every single year in every single policy. So that was done in December to make that change, and we shouldn't have to do that again. So then the last thing I have on the updated tool is the checks and balances that we have in place to include our department policy committee. The policy committee consists of representation from all of our divisions in the department, and they have monthly meetings where they ensure that the policies have been up for their annual review and have completed the assessment tool. So if the tool hasn't been completed, the policy review won't be approved and it'll be kicked back to the owner. And then similar to what we had before, if the policy is marked as not applicable, if any of those drop downs are marked as not applicable, if it's more than 3 of the 11 questions, or if anything is marked as inconsistent or uncertain, the policy is referred to myself and the TIC and Equitable Practices strategist to work with the policy owner on how we can make their policy align better. Okay, next slide. Okay, so what is next for us? The updated policy tool was just launched in January. So as I said, we'll be in contact with all of our policy owners throughout the year to determine if more changes should be made. And then I did want to touch a little bit more on the other work that we're doing. So all the divisions in our department will be completing a combined culturally and linguistically appropriate service standards assessment. And along with my health officer, we work together to make a crosswalk assessment tool that includes the CLAS assessment and also all of the civil rights compliance questions that need to be answered every 4 years. So we have that in a spreadsheet that every division is filling out their own assessment, and then we're going to be compiling all of those answers together as kind of a department-wide assessment and taking action steps to how we can better our department after that. So that is being led by public health with representation from myself, our epidemiologist, health officer, TIC and Equitable Practices strategist, our community engagement supervisor, and we do also have a health educator on that team who is one of the leads for our MCH program focusing on health equity. So we formed a team, like a CLAS and civil rights compliance team last year that consists of representation from all of our divisions, and we'll be working with that team this year to get that assessment completed. And then one result from that assessment. So we don't really want to get ahead of ourselves, but we know that something that's going to come out of this assessment that we need to improve upon is looking at all of our forms. So we decided to, one of the requirements for civil rights compliance is to have an inventory of your vital documents. So we want to start as a scope as small as we can at first. So we have another department-wide team called TICKET. That's an acronym for Trauma Informed Care Champion Implementation Team. So that, again, is a department team with representation from all of our divisions. And they are going to be working on implementing a process for a vital document assessment tool that takes into account all of the CLAS standards and all of the requirements for civil rights, but then also making sure that our forms are trauma-informed and inclusive and equitable. So as we move forward with this project, we plan to use some of the same strategies from the policy assessment tool. Next slide. So what are some key takeaways from the work that I described? While this is a large part of my workload, since I'm helping lead a lot of these projects, This is just another project on the plate of my coworkers, and they're already very busy. So we have learned to set reasonable expectations and ask for their input on when they think they can accomplish a task. Um, this work is very important, but so is the mental health and the work-life balance of our coworkers. So as long as we're making progress over time, we will be better off than we were. Um, Next, I mentioned this before a little bit, but we still experience individuals that question why we're implementing this work or don't agree with it. So we have learned that there's still education and training to be done. And again, there's always room for improvement for shifting our culture as a whole. Um, Also being flexible. I try to be transparent all the time, but especially about like how this is the first time that we're doing any of these things. So if changes should be made or can be made to make this process or any of these tools better, I'm always looking to improve the process so we can implement them. So I always want people to reach out to me if they have any ideas on how we can make any of this process better. And then finally, we always try our best to seek input and opinions from as many work areas as possible. I think I've mentioned more than a few times so far that we have a lot of different groups within our department where we try our best to make sure that we have representation from all of our work areas within our department. We also do the same thing in public health, like with the some of the groups I lead, like our workforce development and PMQI and our strategic plan. We make sure that we have representation from all of our work areas. But then we also try to seek out individuals with lived experience, since that is who this work is impacting. So again, there's always room for improvement for that, but that's something that we always have in mind.